This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy. We go deep and lightly surface the big ideas. Hey everyone, ready for some seriously cool science? We're diving deep into the history of disease transmission, specifically the whole droplet versus aerosols thing. You guys requested this one, and let me tell you, it's a wild ride. We're pulling from this awesome Twitter thread by @OneGoodern.
It's interesting how practical solutions like ventilation, were already in use even before people really understood how germs worked.
Right. Okay, so picture this. The 1850s, Florence Nightingale, the OG of nurses, right? Hospitals back then. Not exactly the cleanest places.
No, not at all.
But Nightingale, she's super observant, and she starts to notice something. The more cramped and stuffy a room, the more patients seem to get sick.
And this is before they really had a good grasp on germs, No microscopes, no lab tests, nothing like that.
Wow, yeah.
But Nightingale, she just went ahead and made a simple change. Open the windows, get some fresh air in here.
And
it worked. It actually worked. Patient outcomes improved significantly.
amazing. But that kind of makes you wonder, if they knew about ventilation back then, why did we forget about it later on?
Yeah, why did we? Well, that's where things get interesting. See, in the late 1800s, you had guys like Semmelweis and Lister coming onto the scene.
Oh yeah, the hand-washing guys.
Exactly. They revolutionized healthcare with hand washing and antiseptics. Huge shift in thinking. Doctors realized, hey, maybe we're the ones spreading these infections.
That's like a light bulb moment, right?
Totally.
But do you think maybe this laser focus on hand washing and contact transmission kind of made everyone forget about the whole airborne thing?
That's the million-dollar question, isn't it? And that's where this whole droplets versus aerosols distinction comes in.
Right.
Droplets, the bigger ones you can see, they fall pretty quickly. Think of when you sneeze.
Yeah.
But aerosols, they're tiny, invisible, and they hang in the air, kind of like smoke. Think about how long cigarette smoke lingers, even after someone's done puffing away.
Yeah, I hate that.
Right.
So even way back then, before World War II, scientists were already showing that some of these tiny particles could stay airborne for a long time and spread disease.
Absolutely. They even tracked smog particles, which are similar in size to viral aerosols. Guess what they found?
What?
Those particles could stay up in the air for weeks.
Wow, weeks.
Yeah.
But here's the thing. Even though airborne transmission was clearly proven, it wasn't widely accepted. Why not?
To understand that, we got to jump ahead to after World War II. Research took a bit of an unexpected turn then.
Okay.
There was this one scientist really digging deep into how these pathogens spread, focusing on droplets and aerosols.
Sounds promising.
But there was a problem. The tech back then was much better at detecting bacteria than viruses.
So they could see the bacteria in the droplets, but not necessarily the viruses in the aerosols.
Exactly. And their research, it showed that a lot of the common bacteria, they were mostly found in those bigger droplets.
So that kind of reinforced the focus on droplet transmission and hand washing?
It did, but there was a big exception. Tuberculosis. They found TB in those tiny, lingering aerosols.
So they already had an example of a major disease that could spread through the air. Huh.
They did. But TB develops slowly, and it was treatable with antibiotics, so it was kind of brushed aside.
Almost like it didn't fit the story they were telling themselves.
Right. And the interesting thing is scientists took what they knew about bacteria and kind of, assumed it applied to viruses too.
Even though they couldn't really study viruses the same way.
Yeah, and you know what? They even had evidence to the contrary with TB.
Wow, talk about a missed opportunity.
Right. And that's where we see this droplet theory really taking over. It shaped how we thought about infection control for decades.
And not always for the better, I'm guessing.
You got it.
So we're in this droplet theory world. What happened? What were the consequences of everyone being so focused on just droplets?
Well, you got to think, if you're convinced that most germs spread through big old droplets that fall to the ground quickly,
Yeah.
you might not be too worried about ventilation.
It's all about hand washing and wiping down surfaces.
Exactly. Windows, closed, ventilation systems, often not great. And those fancy HEPA filters they invented during World War II. Forgotten.
Wow, it's like we went backwards.
Kind of, yeah. And then you had vaccines and treatments popping up. That made people even less concerned about transmission. Right.
We've got this. Germs are no match for us.
Right. But here's the thing. Just because something works for some germs doesn't mean it works for all of them.
Right. They're not all the same.
Nope. They have different ways of spreading, different weaknesses. It's like, assuming all cars run on gas when some are electric.
Oh, good analogy.
Right. And that brings us to another fascinating twist. Zoom ahead to the late 1900s, early 2000s. We finally got the tools to see what was really going on with those tiny aerosols.
We could finally see the viruses.
You got it. And what they found, total game changer. Viruses like the flu and, yeah, even, well, that one that caused a lot of chaos. They were showing up in way higher heppers and aerosols compared to those big droplets.
So it was true. What they couldn't see before was actually the more important part.
Exactly. But hold on. Why were those viruses hanging out in the aerosols so much?
Yeah, why is that?
Well, think about it. It's about where those different microbes like to live in your body.
Okay.
Lots of bacteria. They love the upper airway, throat, mouth, nose. That's where those big droplets come from.
Right.
But viruses, they often prefer to set up shop deep down in the lungs.
And the lungs are where those tiny aerosols come from, right? When we breathe.
Bingo. Different bugs, different homes in the body. And that changes how they spread.
It's like an ecosystem, almost.
Exactly. But here's the thing. Even though science was proving this whole virus-aerosol connection, most of the world was still stuck on droplets.
So we had the science, but it wasn't changing anything.
Pretty much. Healthcare systems, all those rules about infection control, even public health messages, they were all stuck in the past.
Oh, man. So even when they had the right information, it was hard to change things.
Yeah, it's like turning around a giant ship, Takes a lot of time and effort. But you know what? This whole idea of aerosol transmission, it really changes how we protect ourselves.
Okay, I'm listening. What can we do differently, knowing what we know now? So all this time we've been told to, wash our hands and not get too close to people, basic stuff. Is all that wrong now that we know about aerosol?
No, not wrong. Just, well, incomplete, I guess. Those things still matter for the germs that spread in those big droplets. But yeah, we need more when it comes to the viruses that can just hang out in the air.
Okay, so we're not ditching the old rules, just adding new ones, right?
Right.
So, what are some ways that this aerosol thing changes how we think about things, like everyday stuff?
Okay, imagine this. You're on a bus, right? Packed.
Ugh, hate that.
Yeah, me too. So before, you just try not to sit by someone who looks sick, right? Coughing, sneezing, the whole bit.
Right.
Now, you got to think about ventilation, too. Is the air all stuffy? Are any windows open? Is there a decent ventilation system?
So even if nobody looks sick, you could still be at risk if the airs weren't moving around enough.
Totally. And this goes for everywhere, indoors, really. Restaurants, offices, gyms, even your own house.
Wow, it's like we're seeing the world with new eyes now. Suddenly I'm noticing airflow everywhere I go.
That's the power of knowledge, right? Changes how you see things, helps you make better choices.
This whole deep dive has been mind-blowing, honestly. Never thought so much about opening a window before. Makes you wonder what other simple solutions we've forgotten about.
Yeah, sometimes the best answers are right in front of us, Simple stuff works.
This Twitter thread by @OneGoodTurn was amazing. And for everyone listening who wants to learn more, they mentioned another user at UCADS who posts a lot about the newest research on this aerosol stuff.
Definitely worth checking out, yeah.
So, if there's one thing to take away from all this, it's that germs are sneaky.
Oh, they are.
Knowing how they spread, the whole droplets and aerosols thing, it really can make a difference. Helps us protect ourselves and the people around us.
Couldn't have said it better myself. Knowledge is power, right? Especially when it comes to health.
Absolutely. So everyone listening, stay curious, stay informed, and for goodness sake, open a window once in a while. You never know what might be floating around out there. Thanks for joining us for this deep dive.
ATMB. Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.